Hi, everybody. This is April, and I'm going to give you an overview of the diagnosis of gender dysphoria. The DSM-5 breaks it down into gender dysphoria in children and then also gender dysphoria in adolescents and adults. There are several criteria that individuals have to meet in order to be diagnosed with gender dysphoria. For gender dysphoria in children, criteria A states that they need to have a marked incongruence between the experienced and expressed gender and their assigned gender, and that this needs to last for at least 6 months. And then their symptoms have to be manifested by at least 6 other individual criteria, of which one of them must be criteria A1, which is a strong desire to be of the other gender or an insistence that one is of the other gender or an alternative gender different than what is an assigned gender. So that must be present. In addition, they must have 5 other criteria that they meet, such as in boys, there has to be a strong preference for cross-dressing or simulating female attire. Same goes for girls. They have to want to be wearing only typically masculine clothing. Another criteria is having a strong preference for cross-gender roles in make-believe play or fantasy play. Another criteria would be a strong preference for toys, games, or activities stereotypically used or engaged in by the other gender. We're also looking at a strong preference for playmates of the other gender. In boys, which is meaning the assigned gender, there should be a strong rejection of typically masculine toys and a preference for things that are typically feminine. In girls, it would be the opposite of that. We're also looking for a strong dislike of one's sexual anatomy or a strong desire for the primary or secondary sex characteristics that match one's experienced gender. So as I said, 6 of those need to be met, especially A1, which is a strong desire to be of the other gender. Criteria B states that the condition is associated with clinically significant distress or impairment, but we see that with all DSM diagnoses. Gender dysphoria in adolescents and adults. Again, there needs to be a marked incongruence between the experienced and expressed gender and the assigned gender of at least 6 months duration. Now, there is a little bit of difference here. They need to have 2 additional criteria out of the following 6. One would be a marked incongruence between one's experienced or expressed gender and primary or secondary sex characteristics. 2 would be a strong desire to be rid of one's primary and or secondary sex characteristics. 3 would be a strong desire for the primary and or secondary sex characteristics of the other gender. 4 would be a strong desire to be of the other gender or an alternative gender different from when you're assigned gender. 5 would be a strong desire to be treated as the other gender. And 6 would be a strong conviction that one has the typical feelings and reactions of the other gender. Again, for adolescents and adults, they need to only have 2 of those criteria under A. Criteria B, again, the condition is associated with clinically significant distress or impairment. There are specifications for gender dysphoria in adolescents and adults. You can also add the specification that there is a disorder of sex development. For children, we can add the specification that there's again, a disorder of sex development, which means the sex organs have not developed appropriately for that gender. Also, additionally, if an individual is post-transition, meaning that they have started to receive hormone replacement and they've had surgery or they're basically transitioned to full-time living in their desired gender, that would be another specification that we would want to give. And let's see, moving on to the next slide. Some of the diagnostic features of gender dysphoria. Again, there's an incongruence between the gender that they've been assigned, and that's the gender they've been assigned at birth. And in this case, we're going to refer to that as natal gender, and what they experience or what they identify as. This discrepancy is what is like primary and central to the diagnosis. So without that, you're not looking at necessarily a diagnosis of gender dysphoria. It's important to note that it shows itself differently in different age groups. So prepubescent natal girls with gender dysphoria may state that they want to be a boy, assert themselves like a boy, and may even be perceived by strangers as boys. And they don't want to have feminine attire or participate in things that are traditionally feminine. Boys, again, may wish to be a girl, try to dress like a girl, do things that are traditionally feminine. Excuse me. In adolescents with gender dysphoria, clinical features may show those of children or adults with the condition, depending upon their developmental level. This is when you start seeing a dislike for one's own genitals, because they've become more aware of the fact that their genitals do not match the gender that they identify with. Some of the things that support the diagnosis is like when puberty starts, natal boys may start shaving their legs and try to basically eliminate anything that makes them look more masculine. Women or females might start binding their breasts, wear loose clothing to make their breasts less visible and things like that. At this time, oftentimes we'll start seeing individuals taking hormone replacement therapy, obviously with supervision, and start trying to live more with the gender that they identify with, cutting their hair, things like that. Basically anything they can do to appear to be the gender that they identify with. Some of the prevalence of gender dysphoria, it ranges from 0.005% to 0.014% for natal adult males. And for natal females, we're looking at approximately 0.002% to 0.003%. The DSM notes that this is probably an underestimate because a lot of individuals who are experiencing gender dysphoria do not seek out hormone replacement therapy and aren't being seen in clinics for the clinical aspect of it. Some of the risk and prognostic factors associated with it. Again, like with a lot of the diagnoses, we're looking at temperament, we're looking at environmental factors, we're looking at genetic and physiological factors as well. Culture, individual gender dysphoria have been reported across many countries, so it's not something that's typical just to the United States, just to the American culture. We're seeing it in other cultures and in other countries as well. Some of the consequences of gender dysphoria is that children that are experiencing it tend to fail to develop same-sex peer relationships, social skills, things like that. There's also, of course, a lot of stigma and discrimination against individuals who are transitioning and starting to live with the gender that they identify as. There's, again, differential diagnoses that are associated with it. Nonconformity to gender roles. This is something that is distinct from gender dysphoria. Also, transvestic disorder. This is something that occurs in both heterosexual and bisexual adolescent and adult males. It's not something that's generally seen in females. And this is basically an individual who enjoys cross-dressing, but doesn't necessarily identify as the opposite gender. There's also body dysmorphic disorder. And then sometimes we see schizophrenia and other psychotic disorders. Comorbidities that go along with it. As one would expect, you would see higher levels of emotional and behavioral problems, anxiety, impulse control, depressive disorders. In children that are prepubescent, again, age is associated with having more behavior or emotional problems, mostly because of the non-acceptance of gender dysphoria. It's very difficult in most places to be going through this and to be living through this. So there's going to be a lot of ramifications, seen with, again, depression, anxiety, and things like that.